Hello and welcome everyone. This is the second in a series of online webinars that IIDA headquarters is producing to further connect our community of members. I'm John Czarnecki. I'm the Deputy Director and Senior Vice President of IIDA based in Chicago. Welcome to my apartment in Chicago. And also welcome to the homes of 4 leading healthcare design professionals from around the country. Our discussion today will be focused on healthcare design. Even if your own work and practice is not focused on healthcare, we know that the whole world now is interested in healthcare. And I'm sure you'll find the next hour really interesting. We're going to try to pack a lot into the conversation. This session is approved for 1 Health Safety Welfare CEU from IDCEC for interior designers. And further information should be on your screen in a moment, right there. So if you're interested in continuing ed credits, take a screenshot or a photo of your screen or the email to your credit. This webinar is also being shared live right now on IIDA's YouTube channel. If you're watching from there, you can post questions in the comments and we will try to get a few in the Q&A near the end of the discussion. So let's get started with some quick introductions, just to identify who you are and where you're based. Amy, if we could start with you.
Sure. Amy Mays, Associate Vice President and Interior Design Director with HDR, and I'm in the New York office.
Great. Donald?
Hi, I'm Donald Cremers. I'm with HOK and I'm in the San Francisco studio, and I'm a principal and project designer there.
Tama?
Hi everyone, Tama Duffy Day. I'm with Gensler. I live in Washington, D.C., just blocks away from our nation's capital, and I oversee portions of our health and wellness practice.
And Dr. Hernandez?
Please call me Manny, by the way. Good afternoon, everyone. My name is Manny Hernandez, and I'm a Principal of Strategic Innovation and Healthcare Practice Leader for Kaler Slater, and I am based in our Milwaukee office.
Great. And also to let the audience know that Manny authored an article that was on Healthcare Design Magazine's website last week called How Design Plays a Role in Responding to the Coronavirus Pandemic. You can find it at the Healthcare Design Magazine website. So to start out, before we get into the healthcare specific discussion, I want to hear from each of you. We're all working from our homes and yet trying to do the work that we regularly do. So for each of you, how are you doing? How are your teams doing? How's your firm doing at this time, to give the audience a bit of a snapshot on the state of how your work is going along? Tama, if we could start with you.
Sure. Well, I think personally, day to day, it really differs, ups and downs. I need to go for walks and runs maybe more than I did in the past. My cat thinks it's fantastic. He gets to sit on my lap 24/7. The firm is doing okay. You know, luckily we're really diverse and working remotely is really typical for us. And I really think it's been pretty extraordinary. About the end of February, I think because of our offices in China, we really saw that something was happening and we needed to act quickly. So in about 7 days, really, we were able to have 6,500 people working virtually seamlessly. And kudos to our IT team that really supported all of us in our new learnings.
Great. Manny?
Well, I think I, like Tama, have gotten a lot more outdoor time than I've had in a very long time, which has been good. But so far, day number 452 in captivity continues along a smooth course. You know, I think things at Kaler Slater have been good. We made a very smart decision last year to migrate our entire team to laptops. And so when we made the decision to have everyone work from home, we were able to accomplish that in a matter of hours, which was amazing. And we really didn't skip a beat at all. As a team, within our healthcare team now, we are really focused on identifying how we can best add value to our clients right now as they're struggling with the challenges that they're facing, preparing to increase their capacity to meet the needs of the community.
Great. And Amy?
Yeah, we're doing okay. I think 3 weeks ago, and just from the New York office, I think 3 weeks ago, when we all left to go work from home, we knew we had that capability and we could do that. Everyone, Manny, like you, is kind of able to work remotely, but I think we weren't really sure what the next day and then the next day was going to provide. And we've actually seen an uptick in a lot of requests, a lot of asking questions, reaching out for help, RFPs, very specific to healthcare. So we're busy. You never know what, when you go to open your laptop, what kind of new information or new requests are out there. So we're taking it day by day, but we're definitely, we're seeing a lot of activity, I think, in the healthcare in the short term, definitely. I think there will always be long term after as well.
Mm-hmm. And Donald at HOK in San Francisco?
Similar experience to what has been said here. I think one thing that really surprised many of us is how much time we actually spend now where we're so aware of communicating with each other because you schedule so many conversations and you go from one conversation to the next. And I think that's just been something that has been surprising to all of us. We're used to working remotely when you're with a larger firm that has a national presence or an international presence. A lot of our work happens remotely anyway. So this is just kind of taking it to the extreme. The way we're able to manage this so quickly and continue running smoothly surprised everyone, and it was a nice surprise. But with our work that happens in our studios in China and Hong Kong, we also had some preparation for this as well. Sort of seeing how things unfolded there in the weeks before it really hit us in the United States. So that really helped us a lot. In terms of how we're working with our clients, we have a broad practice where we focus on a lot of different markets, and some markets obviously have really slowed down, such as aviation, hospitality, sports and rec. That's very much in contrast to, say, the healthcare market, which has just really intensified. So we're learning how to balance that as well.
Great. Thanks for sharing that, Donald. Anyone else? Is there any impact on a particular market now that is notable that you feel that you can mention within your firms?
I would say the same as what Donald has said. Different markets are going up and down, and like Amy and Manny has said, it's almost a day-to-day event. I think we're all really trying to not work 24/7 because it's really unhealthy for us. So trying to balance when we learn about the new projects and the new work, and just being as flexible and adaptable as we all can possibly be to accommodate the client's needs.
Great. Let's get into the conversation related to healthcare design, related to what you're doing and what your firms are doing. Right now, are any of your firms involved with the adaptation of existing healthcare facilities or repurposing for surge capacity? The conversions we're seeing with convention centers, arenas, pop-up facilities, we know that that is the work of the Army Corps of Engineers on behalf of FEMA and HHS. We are also seeing that there's work related to conversion of hotels, college dorms, other structures, other underutilized spaces. And are your firms involved in any of that yet in any way? Amy, if I could start with you, you're with HDR, one of the largest firms in the country, has done a lot of work related to government work. Is HDR involved with this in any way?
We are. As I mentioned, we're getting RFPs and RFQs. I wouldn't say daily, but it's pretty frequent. And so we're getting asked to propose on, and these, I would say the clients, both in the private and the public sector, most of them are clients that we've worked for in the past. So that relationship is there. I think that's an easy, quick, in this time of particular facilities. And that's happening in certain regions, obviously, where this is happening more, where we're feeling it more. Obviously, New York City is one of those, but I could imagine that that's going to continue to kind of creep into the middle of America as we, continue through the days. But we are seeing that ask, yes.
You're seeing the ask, you're responding to RFPs and RFQs. Right now, no particular projects yet in New York for HDR related to it quite yet. You had mentioned to me before this call some work with Advocate Health in Chicago. Can you describe that to some degree?
Sure, yeah. So Advocate Health is a long-term client of ours for many, many years. And there was kind of a collaborative group, both of HDR, the contractor, a group of many people to create a team that had been working to kind of deliver clinics throughout the Cleveland area. And that's been going on for 5 or 6 years now as a project. But mid-March, they were asked and quickly pivoted to creating surge tents that would be used to kind of assess and then disseminate COVID potential patients to other types of emergency. So it's kind of a one-way flow. You're not mixing. I mean, you guys have all watched the news where people are standing in line. And so really trying to kind of streamline that and separate that. So the team created kind of a packet, right? A very simplified way to kind of create these surge tents and all the components that are required for them, the mechanical, the plumbing that's required, not only to serve the patients, but to support the caregivers in that flow. So there are about 25, 26 of those that are planned and being ready to kind of be online very soon across Illinois and Wisconsin.
Thanks, Amy. Donald, at HOK in San Francisco, I believe you told me that your firm is particularly consulting with your existing clients. Can you tell us more about that?
Well, we've had several different clients reach out to us with ideas about how they could use space that they have available and sort of repurpose it temporarily. And the spaces really vary a lot. One of them was even a big box store on an adjacent site that the client had purchased recently with the intent of eventually building on that site. But they were looking at being able to convert that into some sort of use that had better shelter from the elements than, say, a tent would. But then there's also shell space in new buildings that hasn't necessarily been built out yet. There are medical office buildings that are mostly sitting empty now, and they're looking at what they can do with that. One in particular was the largest space was a physical therapy area, and they were able to convert that into a virus testing site, but they actually had to rework the ducting and the mechanical system somewhat to deal with the negative pressure issues that were required for that. And working with the mechanical engineers, they were able to do that very quickly, just in the matter of a day or so.
Great. Tama, for Gensler as a firm and Gensler in DC, what is your firm active with related to any repurposing for surge capacity?
Well, in the last month, we've really seen a lot of changes, John, in what's happening in our projects. As I mentioned yesterday when we were chatting, some have stopped with really abruptness so that the colleagues and those caring for patients can focus on the hospital, not outpatient care. We started actually a project with urgency for a high rise for a 55 plus community in Pennsylvania. So, senior living is a part of our health and wellness practice area. And as others have mentioned, we're really working closely with the Army Corps of Engineers in design build opportunities to really assist in repurposing these empty spaces for non-COVID-19 patients to allow their hospitals to decant. And then maybe more specifically, slightly different than everyone else has been talking about, I'm sure this is as well happening, but For Henry Ford Health System in Detroit, we're actually assisting their facilities team by taking on some added responsibilities in a project and design development to really allow them their ability to focus on increasing their capacity in actually their fairgrounds. So assisting them by taking on some of their workload, if you will, and their burden.
Workload related to, say, the design decisions that can be made quickly without necessarily overburdening those that are busy with other work at this time, right?
Yes, exactly, because we have kind of developed a template with them in terms of their outpatient care facilities. We're able to move those projects forward, as many of you have already mentioned, kind of based on this concept of relationship and trust. Great.
Thanks, Tama. And Manny, for Keeler Slater, it's based in Milwaukee, but you have projects across the country. What is Keeler Slater doing now at this time related to any work on repurposing or reconsidering facilities for surge capacity?
Yeah, John, so we're based in Milwaukee. We have offices in a couple other cities in the Midwest, including Chicago and also out on the East Coast. I think similar to what Donald's experiencing at HOK, we're doing a lot of work with our existing clients right now, really helping them work through the process of determining exactly how much additional surge capacity that they could bring online fairly quickly. So we're looking at existing spaces for conversion into clinical care sites. We're supporting our clients with looking at clinical spaces that had once been mothballed, maybe converted to offices, converted to non-clinical uses that now need to be rapidly converted back into clinical space, and helping them identify the needs both from a facility and an infrastructure state to support that. We have one client that we're working with right now that's looking to create a series of ambulatory respiratory clinics in some of their existing spaces. That would enable patients who are a little bit sicker, but maybe don't necessarily require full hospital admission, to be able to come in, be evaluated, receive treatments, some supportive therapies, and then be able to continue to convalesce in the comfort of their own home while they do that. Another interesting area that we've been working with, we work with clients of all sizes, from very large academic health systems down to small rural critical access hospitals. And a number of our rural healthcare clients and critical access clients who maybe don't traditionally offer an ICU level of care are turning to us to help understand what would be necessary for them to very quickly be able to convert a number of their spaces into critical care beds, to help decompress the system at a regional level, and to be able to avoid transfers, which obviously would create risk for the care providers engaged in the transfer, and having to move patients further away from their home and their friends and their family. So those are the areas where we've been really focused. And then as a team, you know, we're also really focused on trying to ensure that we can provide our clients with the most up-to-date information, particularly around working with the authorities that have jurisdiction, the regulatory agencies, and helping to move through facility and building code reviews quickly, getting those down, you know, from what is traditionally sometimes weeks to months down to, you know, hours to days, to help move that process along much more quickly.
Thanks for pointing that out, Manny, because it's one of the questions that actually has already come through on the chat. So if anyone watching this has any questions, feel free to type out your question in the chat, and we'll try to get out a few of the answers. So the question was related to codes and ADA also. So I'm guessing that your expertise is coming into play in how to not only design a space quickly, but also to make it ADA compliant as needed. And then this code compliance that you're quickly moving through the process, right?
Yeah, and you know, we're seeing a lot of flexibility with the regulatory agencies at the state and local level. I think, you know, they understand that what we're going for right now is going to be the good enough and not the perfect, that a lot of these are temporary spaces that we are just trying to activate for surge capacity, and that they're not intended to be permanent solutions. And so I think they're being very flexible on some things where maybe in the past they were a little bit more strict in their evaluation. And they've really been willing to work with our design teams, work with our clients to help think through solutions that will enable them to feel comfortable with what we're doing, with the understanding that if we need to come back at some point and revisit some of that, if it's going to become a permanent solution, we might need to do that.
John, if I can add on, I think, Manny, what you've said is really so true. And some of our healthcare clients are saying, imagine like you're on a battlefield. This is like you're on a battlefield type of care, and really setting up and aligning spaces to care for people as quickly as possible. This is not a process where you submit drawings for code approvals and wait months and days for this. This turns around in moments, as everyone on this call has said.
Yeah, I think as designers, when we were taught, don't let the perfect get in the way of the good enough, that really is ringing true for the past few weeks, is we just need to get it done and get it out there quickly. I know we've received calls from clients as late as, 9 or 10 o'clock at night saying, we need a solution by 7 a.m. tomorrow morning. What can you do for us? And, as designers, I think we're well suited to do that and to be able to pivot very quickly to assist our clients, which is wonderful.
Knowing that this situation that we're in is going to last more weeks, and you're already describing lots of amazing things that you're doing to adjust and pivot and be agile. What do you think needs to be done in the coming weeks from, say, the healthcare design profession, whether it is interior designers or architects, before we return to normal? For this period of time that we're in, any thoughts internally that you have in your firms on things you need to do to actually make this sustainable for however many weeks we're going to keep going with this?
I mean, I'll start with that, John. I think something that we're doing internally, because we don't know how long this is going to last, and we've created a task force. And that's really a tool. It serves a few purposes. It's serving a purpose from communication and an internal communication. There's so much knowledge that we have internally, trying to grasp that and then share that back out with our teams. And every day there's something different and a new scenario and a new case. And so we use that as a platform to share information internally. And then also that in turn, I think is a tool for our clients to know that there's a pool of information that's been gathered to help them through. But I think over communicating in this time is not a bad thing, especially at the rate in which we need to respond to things. So having some of these calls that we do, have them set in place. We have just a wealth of knowledge that we can quickly get to. So that, I feel like that's helping us manage through all of this kind of unknown time.
That point on communication is so important in our conversations. One of the points that came up in one other conversation that I've had related to this is that heightened need for clear, concise, to the point communication, where you're working with clients that don't have time, but you need to communicate something quickly and clearly to make a decision to move forward with. You don't have the luxury of long meetings to discuss all of the options. Any other examples that point to that from your experience of times of the essence? We have to be quick and to the point in how we're communicating with our clients on this.
Well, John, I would say that I think we need to be very deliberate in what we're doing. So I come at this from two different perspectives. I come at this from the perspective of the designer, being a part of the team at Kaler Slater, but I also come at it from the perspective of a client, because I'm still clinically active and as an emergency physician. And I worked clinically last week, and I'll be working clinically again next week, right at the height of the pandemic. And what I think a lot of our clients are looking for right now is certainly, to Amy's point, and the point of everyone else on the panel today, they're looking for rapid solutions, and they're looking for very quick tactical things that are going to enable them to achieve their success today. What they're not necessarily looking for is to be inundated with information that is not really going to add value. So I think as designers, as we think about our messaging, I think internally within our teams, I agree with Amy 100%. Over communication is the key when you're working remote like this. I think with our clients, we want to be very thoughtful and tactical with how much we're communicating with them and making sure that we're attempting to add value and not necessarily just using this as a business development opportunity with our clients. At the same time, as designers, I think that we can play a very valuable role in helping our clients understand the challenge that they're trying to solve right now. You know, as I had mentioned in the article I wrote a couple of weeks ago, space alone is not going to get us through this. Space has to be placed within the context of the other resources that are going to be necessary, whether those are human resources or digital or technology resources or other types of infrastructure and equipment. And I think we're in a great position to be helping our clients think through those conversations and really understanding how the areas that we are expert in need to be thought of in terms of the larger context of their pandemic response. And really, this is, I think, a great place for all of us to be leveraging our design thinking and putting our design thinking hats on and really going in and rolling up our sleeves and being a part of the team to help them think through that. And I think they value that when we can come to them with some pretty quick solutions.
I'll maybe add on as well. I think that those are really great comments, and maybe a shout out to our HR team. You know, a lot of people deal with this in very different ways, and so they've found ways to really communicate with us on how to sit or stand ergonomically in your own home when you haven't necessarily purchased the right chair, and, you know, caring for us as well so that we continue to be great at design thinking and being able to focus on the task at hand and being able to communicate probably many more times a day than we are used to, like always, constantly on calls every morning, every noon, and every night. But we've also brought some joy and humor into the conversation, you know, like competitions of who has the silliest shoes or who has the best, you know, employee at home, whether it's their child or pet. You know, looking for some brevity as well and giving tips of how to stay sane at a time that, you know, none of us are used to being engaged at this level of communication.
Mm-hmm. Absolutely. It's a challenge for everyone in all work that we're doing. And you're all learning from your either current clients or your recent past projects. Donald, you had already described a hospital that you're currently working on for the Hong Kong Public Health Authority, and completely different context, but in Hong Kong, you had told me previously that they were learning from their experience from SARS and past epidemics in how they want their hospital designed. Can you describe that a little more and how that hospital is being designed and the lessons you're translating to your current work?
Sure. Just for context, the group from HOK that's working with the client in Hong Kong, we have a Hong Kong studio, and then we also have colleagues in the Seattle and San Francisco and St. Louis studios that are working on that. So we're obviously already working across many different time zones, and we're doing a lot of that work remotely. But we've also traveled a lot, and we've done a lot of in-person communication with them, whether it's with groups of users, if it's with executives, it's doing site tours and things like that. So that has certainly evolved through all of this. But the approach that they take to planning a facility always references back to previous experiences that they've had in epidemic situations like this. In particular, SARS is always their reference point. And it's something that we're all familiar with because we are aware of what happened. I believe this was mostly about 15 years ago, but they really lived it and experienced it in a very different way. So they build into their planning already the idea about how they would manage inflow into a facility and separation of people who are potentially affected versus those people who are not affected as you enter the building, as you register, as you get that first line of triage and that first line of defense. but then also certain areas of the building which have sort of these hidden subdivisions within them, so that you can take a patient ward module, say, and you could literally separate it in half, as it already has separate mechanical systems, and it has flexible barriers that you can use to control the separation of that. And we just don't see our clients in the United States necessarily approaching their planning and facilities that way. Then in terms of materiality, just the surfaces that we deal with as interior designers is really quite different. We are not able to use anything that's really absorbent in any way. So obviously no woven fabrics, which we also see that we're tending to get away from that in the United States. But even things like acoustic ceiling tiles or acoustic surfaces on walls and ceilings, that just doesn't exist there. It's just not something that they will even consider. So we have kind of a different palette of materials that we're working with there, and that really pushes us to create a different response, to still create an environment that is comforting and supportive to the staff and the providers and the patients and family that are there.
So Donald, based on that experience, and it's hard to predict the future, but if we pivot to a conversation about when we return to some semblance of normal, and what is the impact on healthcare design, healthcare interiors? This example from Hong Kong, you're saying in that project, no woven materials, no acoustic ceiling tiles. Are there things that might transfer from a project like that to work in the States, or from your knowledge and your expertise, are there things in the States that would not allow that to happen?
I think we're going to see a lot of opportunity for product development and sort of taking products and revising them to perform in a different way. I think there's going to be a huge push for that. So it's a great opportunity for us as designers to work with manufacturers, and really for manufacturers and material and product engineers to really push themselves to see how we can make materials perform in a different way. I also think there's going to be a huge impact on more of those assembly spaces that we have in our healthcare environments, the waiting areas, the cafes, the education spaces, that the way we see our space, our personal space, our individual space, and how we make that work as a collective space, I think we will see our clients really demanding that we have to have a different approach for that.
Great.
You know, Donald, I think that's interesting, because I think when this pandemic is over and we have the time to really Monday morning quarterback what happened, I hope there will be a lot of conversations about the key design drivers in healthcare and what we're planning and why we're planning it. Because I always think of when we attempt as designers to plan a lot of these spaces for surge, for pandemic, they tend to get value engineered out of our design projects. You know, understanding that sometimes these are 100-year flood events, but the funny thing about a 100-year flood is you can never predict when it's going to happen. But when it happens, you need to be ready for it. And so I think it's going to push a conversation around these very things, around materials for infection control, around spaces to respond to capacity, around the technologies that we use in the building to keep our patients and our staff safe. And I hope that's something that we don't lose sight of as the design community when we get past this and are able to return to whatever the new normal will be going forward.
Yeah, that's interesting, because I think about New York City during Sandy, and we're a little scarred from that, right? It was everything that we've done since. You know, you need to consider a flood wall. Where are you putting your MEPs? And so that's very kind of centric here, but I'm sure it happens in New Orleans or in other places where these, you know, kind of singular catastrophic things have happened. But because this is covering us globally, I do see that there's going to be a shift and a move and potential new guidelines that could come out of this. I mean, I don't think this conversation is going to go away.
Mm-hmm.
Yeah, and I'll add on as well. I've been really thinking about this, and I think that the industries are going to morph, and that there won't be such distinction between them. You know, I was thinking of any examples we could mention today, like, you know, retail plus. In other words, how could their drive-through
Yeah.
areas be used for testing sites? Many of us have talked about hotels. So how could their rooms be modified for perhaps observation beds? Maybe it isn't the extreme cases. And so, you know, we're already beginning to research and look at how to redesign airports, community centers, convention centers, sporting venues, senior living even. And, you know, even our ambulatory surgery centers, how can we really look at smaller decentralized care and think through a community lens of, during something like this, how could we distribute the patients in a more thoughtful way and be prepared for that for future.
That's really good. The thoughts on the future related to, say, impact on the design profession overall, building on what Tama just mentioned, all of you are actually with large interdisciplinary firms. Healthcare design is one part of that. You're also, all of your firms have workplace design as a significant aspect of what you do, and workplaces are a significant aspect in healthcare. So any thoughts that you have on impact related to the workplace?
I think a part of it is like embrace the blur. Like look at how these things morph and what we can learn from each other's industries. People have mentioned, will workplace density remain as dense as it is? And, you know, maybe, maybe not. Obviously, you know, money plays a part into all of these conversations, how much we can afford to pay for our real estate in our space. But now that we've become experts at working remotely at home, maybe we rethink how to work. You know, hospitals don't have laptops for all their employees. Manny, you probably know this better than any of us. They don't employ laptops. So it's been a real learning curve to be able to work with them remotely and still kind of keep business going.
Yeah, absolutely. And, you know, I always think of our role as designers in helping our clients solve challenges and helping them understand the decisions that they're making. My hope is when we come out the other end and we take you know, we pull up and we start looking at healthcare design and continue to see ourselves as the healthcare professionals that we are and understanding the critical role that we play in design. We need to help our clients pivot from designing Swiss watches back to designing Swiss Army knives. We often create environments that are so bespoke, oftentimes at the behest of folks like me, the clinical folks who want it to do a very specific thing, understanding that it's great in that moment, but there's going to come a time when that space is going to have to be flexible and to do something else. And so really making sure, you know, I'm not a big fan of the word future proof, as I am a big fan of the phrase future ready, and making sure that these spaces can do what they need to do. And again, I think as design thinkers and people expert in that process of exploration and iteration, we really should be at the center of those conversations and helping to facilitate and guide our clients to solutions that are going to help them not only on a normal day, like everyone was experiencing 2 months ago, but also what I'm going to be experiencing next week when I step back into the emergency department, and to be able to be successful and deliver the highest level of care and safety and empathy that is necessary to our patients at any given moment in time.
So we have a few minutes for some audience questions, and I'll throw one at you here. Given the shifts in volume of your projects, especially related to healthcare, to get the work done and, as you described, to get it done quickly and to be agile, are there any unique new partnerships that you have formed to get that work done with any other design or architecture firms, or new collaborations that you just started related to getting this work done now? Anyone?
I could say that in some of the projects that we're working on, as we look at our resources across our studio, or across our entire office, that there are some teams that have slowed down a little bit. So we've actually taken individuals and we've assigned them to a technical kind of project that they haven't necessarily worked on before. So it's been an interesting challenge to take someone who you're not even working with side by side, you're working with remotely, and you have to give them kind of a primer on, this is what is happening in this kind of medical space. You may have had a personal experience with it some way, but you maybe haven't had a professional experience with it. So you have to coach these other teammates that you're working with, and that's been an interesting challenge. But it's also been kind of exciting to see our other teammates step up to the challenge and actually be interested in it because of what's happening in the world around them.
I wouldn't say, I'm not aware of any external partnership, but we work on a work share model, depending on the size of the project and expertise and where you reside. So that's been very helpful for us as projects shift and priority. These things that didn't exist 3 weeks ago, we now potentially have new work on the front line. Being able to work share has been extremely helpful for us internally.
And maybe an example of a student. So a student joined our studio a month and a half ago, and you can imagine, they're still in school, and normally you'd walk by and say, hey, how's it going? Do you need any help? And he's an extrovert, and we've still managed to figure it out, to establish ways to teach online and to share your screen and show file organization and where to find things and resources. And quite honestly, everybody just has to understand a little bit more empathy and try to find a little more patience in really taking the time to still learn and enjoy and educate in this time when things seem to be moving so very, very fast.
Mm-hmm.
So I'm a firm believer in never let a good crisis go to waste. And so I think we've been looking both internally and externally at a couple of things. And I think internally, there's an acknowledgement that when we come out the other end of this, it's going to take some time for the economy to bounce back. And our clients are experiencing significant economic challenges right now. And so we are pushing ourselves internally to use this as an opportunity to ask ourselves how to work smarter, not necessarily harder. And again, where we can be innovating internally to improve the design process, accelerate the design process, and lower the cost of the design process for our clients, because there is going to be a period likely of economic austerity that comes out of this. On the client-facing side, we're all national firms that are here as panelists today. And I know, we all oftentimes have to travel great distances when we're doing things like construction administration and other aspects of the project. So I know one of the things that we're beginning to look at internally is if this is a prolonged duration, what is our plan for supporting CA doing that either remotely? And what are the technologies that we can leverage to do that? Or do we need to be developing more partnerships with folks who are closer to our clients to avoid unnecessary air travel, other types of travel that risk exposure to our teams, exposure to our clients? So we're thinking through all of those things right now and really trying to figure out how to iterate our way through to some of the best possible solutions.
Manny, this next question is for you, given your experience both as a physician and in the design profession. And this question is about the current situation. So the question is, the person is asking, we've been informed by some clients that unless these temporary health facilities are located adjacent to a hospital, they're not useful because of staff shortages and proximity are necessary. Can you speak to that?
Yeah, staffing is always one of the things as a clinician that I worry about. And pretty much when I'm working in the ED, the first thing I do after getting sign out from the colleague I'm taking over from is to go over and have a conversation with the charge nurse about how short on nurses we are that day. So staffing is a real challenge, and it's something that we need to think about. I think you will find in different parts of the country and different organizations, they're going to be able to redeploy their staff differently based on the number of resources that they have. Organizations that started out challenged with staffing, I think are going to continue to be challenged with staffing. And so proximity to places where you can improve or increase the productivity of your staff, so have more of your staff caring for more patients individually, is going to be important. Places that are doing the remote hospitals, like in Chicago, where they're taking McCormick Place, and I know in New York they're using the Javits Center to do that. Other communities that are looking to do that, we're going to have to figure out how to bring in additional staff to support that, whether that is through communities that are being less impacted, loaning their staff to communities, much as we do sometimes during natural disasters, trying to leverage technology better, or asking our staff to work even harder than they already are. I know in New York, healthcare providers now are working 12, 16 hours a day just to try and keep their heads above water. So I think it's going to be a combination of a lot of things. And within each community, I think it is going to be based on the resources that they have available to get through the crisis right now.
And probably cross-training, right? Because now
Absolutely.
hospitals are furloughing staff because they're not trained in acute care. So the more cross-training that we can have in this industry to keep people employed, to be able to, now staff the ED in more one-on-one capacity than in the past is really critically important. So how this impacts our education system is really critical as well.
It's interesting that you should say that, Tama. I just read an article this morning that over in, I want to say it's Norway, they're taking flight attendants who have been furloughed and training them as health aides very quickly. They're giving them, 12, 24, 36 hours of training to be able to perform some basic care functions to redeploy staff. And I think you're absolutely right. I think we can also rely heavily on paramedicine, so EMTs and paramedics, to serve a vital role. We're obviously seeing reactivation of folks who have retired and redeployment students. I believe it was NYU that was trying to graduate their med students a little bit early to get them out on the front lines. And I think in a time like this, every little bit helps as long as we're being very smart about how we're deploying those resources.
Right. A question related to technology for you. Looking at, again, the future and the impact on healthcare, architectural interiors, what do you think the need is related to technology to change? Is there anything related to automation and technology that needs to change or grow to enhance healthcare interiors, whether it's just automation of, say, staples such as lights or shades, or are there more complex needs related to technology that need to come to the forefront now in healthcare?
I think you see so many systems in place that it's really difficult. It's difficult for systems to talk to each other, and it's difficult for people to be trained on all the various systems. So if there's some way that these various systems or platforms could talk to each other, or just the number of platforms becomes reduced and simplified, so that everything is blended in a more seamless way and a more intuitive way.
Right, and with technology changing so rapidly, I think, having less platforms or more seamless ability to let those talk to one another it is certainly going to help. I think technology integration is always kind of the very last thing. It's always, you're waiting for the newest and greatest thing. So,
right.
Yeah, I think we need to break the technology out into its different components. There's the building system technologies that are going to help us run smarter, safer buildings, and those certainly all need to be talking together. There's the predictive analytic technology that is giving our healthcare providers the knowledge and information that they need to care for patients. And then there's just the clinical technologies that I might use at any given moment when I'm at the bedside caring for patients. But I think with all of those, we often find that technology planning is a very reactive process. It's either reacting to a design solution that's been created, or it is causing a design solution to react to it. And so I believe very strongly that as we look to the future and the role that technology is going to play in design, that has to be a very integrated part of the design process from the very beginning, when we first start the design process and asking about what does success look like, and how do we define success, and what is the role that technology plays as an integrated part of the solution that has to work with the buildings, the human capital, and the users within those environments.
Another question, and this, I'm pivoting back to a question that's about the moment of time that we're in. So thanks for pivoting related to the questions that are being thrown at us. The question is, how can design thinking assist related to solutions for the supply chain that's needed now related to, say, masks, ventilators, etc., the things that are needed now? I will add to that. I know that we've talked separately offline about this is an industry with fabric manufacturers and other manufacturers. So one question is about design thinking. How can that be employed? And the other is, do you have any ideas on how this industry can assist at this time? Throwing a lot at you.
I would say, just as car manufacturers have shifted to, and other different manufacturers have shifted to help with ventilation, with vents, I think it would be interesting to see what this market, like fabric manufacturers, could potentially do. I know that is a tricky time, but something that, and I think it kind of goes with that creative thinking. Our Princeton office, we have a model shop, small, but produces, large models for the firm. And a group of individuals have started making the Y valve that you can attach to the ventilator to support 2 individuals, and those are going to be donated to the Princeton Medical Center. So those little ideas come out of the woodwork, and even though it's it's helping one community, if that happens all over, I love hearing those stories.
Mm-hmm.
Yeah, I would agree. It's, if you think, again, taking the war analogy of having no waste and using the resources we have at hand, in almost every design firm and every university and education facility, we have printers, all available 3D printers that maybe with some foresight could have been all adapted to help us provide our own supplies for our own medical employees and our colleagues to safely travel to construction sites. So it's really looking at what else can we do with the tools that we have, and how can we, quickly adapt to these changes. And I think maybe one of the challenges with this is we're not sure how long it will last. Like if someone right now said, there's 3 more months, maybe we need to think like that so that we could start now to reimagine, if this is still happening in 3 months, what can we do right now today to positively impact us in 2 months, in 3 months, so that it isn't just sitting and waiting for 3 months wondering what's next.
Mm-hmm. Mm-hmm.
Healthcare as an industry is a very risk-averse industry, obviously because people's lives are on the line. And when we make mistakes, they can have catastrophic consequences. But there's a significant value in introducing design thinking into healthcare. One of the biggest learning items for me when I received my design degree was pivoting from being this very hard data, evidence-driven thought process as a physician to understanding the value of brainstorming, iteration, failing forward, and just trying something to see what happens. And I think that's where design thinking can really be helping us right now. We've got hundreds of thousands, if not millions, of healthcare providers out there right now that are in the moment with their heads down, just trying to keep people alive. But we also need the people out there who are going to stumble on the innovations that are going to help us do what we do better. And I think that is a great role of design thinking, is to help us get in front of the literature, get in front of the research, identify and MacGyver almost, as it were, our way through this. And I think that's an incredible role and something that we should lean into during this crisis.
I like the reference to MacGyver. We'll in the comments for those under 30 to understand what that.
They can email me. I'll let them know all about that.
So we're ending with a laugh, and let's with a message of hope. This was a pretty heavy conversation. The news is difficult to watch. I want each of you to have a bit of a message of hope from what you're working on, what you're seeing, what you're doing, a message of hope to end this conversation. Tama, if we could start with you.
Sure. I always have considered myself really a connector, and I am on the board of Capitol Hill Village, which is an organization that supports seniors and keeps them in their homes as long as possible. And as you can imagine, this isolation of having to stay alone is really challenging for the organization and for the seniors on Capitol Hill. So when I called Children's National Medical Center and I said, how can we help? Is there anything we can do? They forwarded me and forwarded me and forwarded me, and I got to their head of their emergency and they said, yes, can you please deliver 100 fabric face masks? So I was able to, solicit the Capitol Hill Village and Moms on the Hill, and we are making these fabric face masks, of which I sew myself. So here's a cute little one with cats on it, and we're delivering our first 100 to them on Friday. And I think the hope in that is, like, everybody wants to help and do something, and yes, staying at home is a critical aspect of that, but having a purpose and providing people with something else that they can do and connecting them in a way has been really meaningful to me.
That's great. Thanks, Tama. Donald?
Well, I think as designers, we're all inherently curious, and everyone who works in the design industry and is attracted to designers is curious. And there's just such an opportunity for us now to really look for better solutions and to look for more integrated solutions, and to know that we are all resilient, and that we can respond to a crisis situation and still maintain ourselves and still maintain our connections with each other, but move forward and take this as an opportunity to really come up with even better solutions with our clients, with our vendors, partners, with our contractors. And I think that we will come out with even stronger designs from all of this.
Thanks, Donald. Amy?
I think, this crisis has having us put perspective on many things. And for me as a healthcare designer, this is just another reason that I find passion in what I do. And I love everyone that I'm working with, both from the client side and our office. The can-do attitude is just, it's incredible. I mean, it's moving how much people are willing to step up and do anything. So
that's great.
Very proud, very proud.
That's awesome. Manny, we'll end with your message of hope.
Sure. So, mine has been just the joy that I have found in the past couple weeks in the resilience of our communities and our society. At the healthcare level, my colleagues are running to danger while others are running away from it, at a time when they're fearful for the health of themselves and their families. And they do this willingly and thoughtlessly, and it restores a lot of hope in the goodness of humanity. And at the same time, I've just been so impressed with the resilience of the colleagues that I work with every day at Kaler Slater, and their ability to pivot and lean into this challenge and to be there for everybody, to check in on one another, and just to make sure that everyone's okay through this, and to help all of us get through it together. And to really, I think this has even tightened us in our distance. We've become closer as a team. And it's been a really, I think, a wonderful thing that has come from such a challenging time right now. And so I'm very thankful for that.
That's great. Thank you. And thank you to all four of you, Tama and Amy, Manny, and Donald. This has been a really great conversation. Thank you to everyone who is watching. Also, thank you to my team, the IIDA team, whose behind the scenes work made this possible, everyone from their homes. Again, this session is going to be available on the IIDA YouTube channel pretty soon, essentially later today. And if you're interested in receiving continuing ed credit, that information is on your screen right now. So take a screenshot or a photo of that screen to get your continuing ed credit. So thank you again to everyone. A really great discussion. Have a great day.
Thank you, John.
Bye,
you,
everyone.
John.
Take care. Be
Bye.
safe.
Well.